Belinda, you've got about 15 years of experience. You worked in Harris County, and you saw lots of patients come through who were uninsured. What do you think the single greatest obstacle for those uninsured patients is to get health care?
The greatest obstacle, I would say, is probably economic reasons. It's really hard to kind of think of healthcare as being on the forefront when there's no food on the table. So if they have limited economic resources, then can make access to healthcare quite difficult at times.
Yeah, I can see where I've got to choose between going to the doctor and going to the grocery store. So probably when you saw a patient, they were very sick.
Right.
And they, you know, so that is really challenging. Once a patient gets into Harris County, again, what are some of the obstacles to continue that care? So they've come to the hospital, they're very sick, they're seeing a doctor. What's some of the, what now do they have to do to keep getting that care?
There's lots of different reasons why they may not be able to continue the care. One is a continued lack of or limited medical funding. They may have transportation issues. They may be working at a job where they can't take time off to go see the doctor. They might have other children, you know, that they can't leave at home, obviously, or they have limited child care options, things like that.
Yeah. So their discretionary time and money in life, we'll say it that way, is very limited and can even hinder continuing to receive care even once they kind of got in to see the doctor. Is that right?
Exactly.
And here's a really important question for me, because I'm seeing uninsured patients, but not as often as you do. Our nurses are seeing uninsured patients, but not as often as you do. So if, from your perspective, we have an uninsured patient who comes into the hospital, what would you want the nurses, other staff, the hospital chaplain, what would you want them to know about the background of that uninsured person and taking in consideration being sensitive to their needs from where they're coming from? Make sense?
Right. I think it's important to kind of understand that they're doing the best that they can with the limited resources that they have. Sometimes they can be perceived as being non-compliant with their appointments and their medications, but you know, they really are trying to do the best they can with what they are dealt with.
And I think that's an important message for us, because previously in our hospital's history, we've had a more economically stable clientele, patient populace. And now we're seeing more and more uninsured patients. So we're having to learn about their culture and how they manage their children, how they manage what little resources they have. And it's different than how maybe you or I have, or certainly some of our other patients. So I think we've just got to learn to be sensitive to where they're coming from. Thanks, Belinda.
You're
Appreciate
welcome.
your help. Okay.
Thank you.
See how easy that was? Now you're a star.
Yeah, okay.